Innovation has always been key to advancing patient care faced with a virus that has upended life as we knew it. Hospitals have had to rely on innovation in more ways than one, and Cleveland Clinic, a leader in health research and education, is one of the foremost hospitals in the nation. I am joined by its CEO, Tom Mihaljevic, and I should say, Tom, that when I was still traveling internationally, and I kind of, my colleagues would see me on a plane at least every week and a half, and sometimes I wouldn't tell them about the ones I was taking on weekends. But I was in Abu Dhabi, and I visited Cleveland Clinic. You're all over the world, and you're sort of, of anyone we've had on today, you not only have a picture of what's happening with COVID-19 and R&D and dealing with real patients here, but you're seeing it all over the world. So something I've asked a number of our folks today is tell us what you're seeing.
Well, Steve, thank you. First and foremost, thank you for having me. And I'm glad that you visited Cleveland Clinic in Abu Dhabi. I had a good fortune of spending almost 7 years in the United Arab Emirates and help build what is now the largest hospital in the country. We are an international healthcare provider, integrated healthcare delivery system that spans across several continents. And what we are seeing is the pandemic that is spreading immensely rapidly throughout the world. And we're also seeing similar patterns in different countries. So we started learning about the COVID pandemic early on. In January, we started to take care of COVID-19 patients at Cleveland Clinic Abu Dhabi, the one that you visited. And since we're in a daily contact with all the leaders across the system, we became immediately alerted about the complexity of the care that we need to provide, about the ramifications that pandemic could have on our entire healthcare system. And that is when we really started to prepare for the COVID pandemic early on.
One of the things that most people know about Cleveland Clinic, or, if they know anything at all, it's just one of the great leaders in heart and vascular research and surgeries, and you've been the center of that. As COVID is hit, which is, a pandemic and a different sort of challenge, what role do you have in that sort of, the tsunami that we're dealing with right now?
Yeah, Cleveland Clinic is a large organization. We have more than 200 different sites at which we provide care here in the United States, and then Cleveland Clinic in Abu Dhabi. We have a presence in Canada, in Toronto, in Nevada. And so we're a very large integrated healthcare delivery system with more than 72,000 caregivers worldwide. So while we are known for our high-end specialty care, we have a very significant role in taking care of our communities. Every community that we touch here in the United States, predominantly in our home state of Ohio and in Florida. So our responsibility is really to provide a comprehensive community care. So we took a very, very active and early steps in preparing our healthcare systems to deal with the pandemic. And fortunately, we have been able to have sufficient resources, sufficient supplies as a consequence of this preparation. And our caregivers were kept safe, and our patients have been receiving the care that they expect from Cleveland Clinic.
This may be an out of the field question perhaps. I was in Cleveland for a long time when the Democratic presidential convention was held there. I think it was Democrat. Maybe I've lost track of Democrats, Republican. It was a Republican. I go to all of them. So, but not this year. I'm not going to either one. But you go to them, and one of the things I was very impressed with was the community there, and even parts of the city that had some trouble and stress, communities of color. There was enormous pride and connection to those communities from the Cleveland Clinic. And I think one of the questions that's come up is not every town has a Cleveland Clinic, and there are a lot of vulnerable communities. There are communities of color, Hispanic, Black, elder communities that are not as much on the grid in terms of this and are getting a disproportionate impact from COVID crisis. And I'd love to just have you, give advice and counsel, if you would, to others on what we need to begin doing to reach and just change the vector for those communities that are experiencing this such horrible ways.
Well, I'm so glad that you noticed it during your trip to Cleveland. Obviously, we are deeply rooted in this community. Cleveland is in our name. This community is a community that we feel very, very passionately about. And there are a lot of measures that we have undertaken, in particular over the past 10 or 15 years, to increase our presence in the community, in particular in those who are underprivileged, that we increase the access to healthcare and our services to those who are really in the greatest need. So we have increased the number of our primary care and family care physicians several-fold. So currently, our largest operational unit is Cleveland Clinic Community Care, with more than 600 primary care physicians, family care physicians, and other providers. So we are really getting deep into our communities. Probably the biggest lessons for us as an organization can relate to the fact that we have tried to address the needs of the community, but the first step in addressing those needs effectively is to become a part of a community and listen to what community needs, not to assume that we have all the answers to all the questions. So getting deep into community, increase our ability to provide a continuous care and a touch to every community member is very important. And I would just like to add one more thing. This pandemic has taught us about the importance of keeping an entire community safe. We simply cannot succeed in defeating the COVID pandemic unless we provide an adequate care to every member in our community.
There's a discussion I had with Dr. Robert Redfield, and we're going to have one later today in today's program, where he talked very directly. He said, we're going to have people without resources, without homes, that we're going to have to take care of. We're going to have to get them care. We're going to have to isolate them or treat them with respect. That's going to require money and resources to do that. So I really appreciate your thoughts on that. I want to get your insights, Tom, into the technology per se. What's coming? I mean, I sort of look at someone like you. These researchers all around the world. Practitioners. Dr. Fauci, whom we had open today's program, is blowing the whistle pretty hardly on virtually everything, and so he's pretty cynical, right? I mean, I'd say he's cynical. He's hopeful that people change, but he's kind of give a strong lesson. But what he was optimistic about, which I was very surprised, is he does think we're going to get a vaccine. He does think there are really promising developments. I think 2 months ago, 3 months ago, he would have hedged his bets. How do you look? Let me just ask you two parts. How do you look at the possibilities and probabilities that we'll get a vaccine and effective therapies on this, part one? And part two, I'm hoping to have Sam Kulkarni, the CEO of CRISPR, come on next, and I'm fascinated about this stuff coming down the pike. Can you tell us some of the things that you've seen that our viewers have not, that you think will transform healthcare from a technology perspective?
So when it comes to vaccine, the rapid pace of improvement has been unparalleled. We've never seen that much concentrated research effort in a single area during our professional lifetime, for certain. There is an unprecedented degree of collaboration across the world, and we're seeing rapid development of vaccine and the different types of vaccines. Some of them are really, really innovative, as you well know. I would like to voice a sound of caution when it comes to vaccines. Vaccines typically take longer time to develop. We are fast forwarding the first steps in the development of the vaccine, but before we start to apply a vaccine on an entire populations of patients, we have to make sure that they are effective and that they are safe. So there are no shortcuts when it comes to safety. Under best of circumstances, it is my estimate we will have an effective and safe vaccine in the best of circumstances, probably sometimes at the beginning or mid next year, but the actual effect on the public health on a global scale will certainly not be present for at least a year and a half or 2 years from now, on the best of circumstances. What we're seeing here in our research efforts is that research is unfolding not only in the areas of a vaccine, but a number of other areas. Many of us are looking for different ways to treat severely ill patients with COVID symptoms. So we're looking to new drugs that can attenuate or improve the recovery. We're looking at the combinations of different drugs and different therapeutic modalities to speed up a recovery of our patients. And that is really an excited field. And we're learning a lot about the biology of of this particular infection. What we are also working on is a new research on new and protective surfaces on which viruses and bacteria would not be able to survive, and surfaces that, and the new coatings that we could apply on a number of different areas, either in hospitals or in our own homes, that will keep us safe.
And about the kind of the CRISPR front and the technology on that, do you have thoughts on? I mean, I know it's a kind of a strange question, but I mean, when 2-3 years before CRISPR came, or the kind of genetic decoding that we've seen that was coming on, that just shows us. Are you privy to sort of technological leaps that are just a few years ahead that we may not ourselves as lay people know about?
Yeah, we're not really privy to any technological leaps that have not been publicized so far. I mean, it is all public knowledge. When you take a look at the different developments for the vaccine, we're looking for the entire spectrum, traditional spectrum, that is being developed with an attenuated virus, which is something that we've used historically for very many vaccines in the past, to the new developments where we're using the fragments of the viruses, either DNA or mRNA fragments of the viruses that would be injected and that would elicit an immune response in our patients. And these are brand new approaches. We've never used them before. And once again, while I'm very, very excited about the prospects of getting a vaccine, it is always really important to understand that shortcuts in science cannot be made at the expense of safety.
We had a tweet question from us, which we've been taking today for you, from Eco Homes USA. It says, if COVID-19 mutates like the flu, would a vaccine developed now be effective against the next strain? What are your insights there? I know that's the jury's still out on that, but what is your thinking, given your experience of, I think, particularly other viruses that have been serious?
Coronavirus typically mutates in a way that becomes less virulent, meaning that over time, the viruses tend not to be more aggressive, they tend to be less aggressive. And the hope is that over time, we're going to be exposed to the virus that may be more infectious, but will certainly not be more harmful to the host. When we strive to develop vaccine, we strive to develop vaccine for the certain areas in the virus that are least likely to mutate. Now, obviously, this is a new virus. We do not know much about it, although it sounds like we've been in this particular set of circumstances for such a long time. As you know, this pandemic here in the United States started only in January. So we are about 6 to 7 months into really intensely learning about COVID-19, but we plan to develop a vaccine that is going to attack the part of the virus that is unlikely to mutate, and therefore it should be effective, even if a slight mutations were to occur in the future.
Doctor, we have a couple more minutes, if it's okay with you. I'm waiting for our next guest, but I wanted to ask you, we have Dr. Redfield, the head of the CDC, who's going to be joining us for the next band of programming we have here. And I've interviewed Dr. Redfield in the past, and I'm not going to put words in his mouth, but if you talk to him, he's sort of simmering. You can feel him simmering over the frustration that we have not invested enough in our public health infrastructure. And he talks about the vital importance of that. He said, we've been basically getting along on fumes, underinvesting in this, not just now, but for decades. And you're in this business and game, and I'd love to, I'm going to ask him the similar thing of, like, how do we get that right? What does it take? What are the missing pieces? But we think about these times in times of crisis, and once that crisis is gone, the energy in that area dissipates. So I'd love to kind of hear your thoughts, because I was very, taken with what Dr. Redfield shared when I last spoke with him.
Well, I agree with the sentiment. We have to invest more in a public health infrastructure, but the problem that we have to deal with is, okay, what are we going to do now, knowing that the public health infrastructure may not be sufficient, but we have a real demand for our services, and we are responsible for the health of our nation. And there's a lot that we can do, and that will actually what we have been doing during this pandemic that is new and it is unprecedented. I would say that a degree of collaboration, in particular regional collaboration among leading healthcare providers, has been at a very, very high level. Here in our home state of Ohio, all large hospitals and hospital chains have banded together to make sure that we, in a concerted effort, share data, shared practices, and provide care to the largest number of our fellow citizens in an effective way. So there is a way to connect a relatively fractionated healthcare system in the United States more effectively. And when we start to work together in the areas that are important for the public health, there's a lot that we can do. And we have proven it from so many examples of collaboration across the country. And I'll give you another one, virtual ventilator bank. When very many of my colleagues in different organizations, just like we have contributed a part of our ventilator reserves for greater need, that it can be allocated to any future sites of a COVID pandemic, is a powerful example of how large healthcare organization can get together and do good for very many patients.
Well, Dr. Tom Mihaljevic, the CEO of Cleveland Clinic, I'll have to make a date with you. I'd rather see you in Abu Dhabi than Cleveland, but I want to see you at one of the your facilities one of these. Thank you so much for joining us.
Well, thank you for having me, and I would welcome you in Cleveland or in Abu Dhabi or in Florida or any of our sites. So thank you very much for having me.